This is to Laxman Narasimhan, the impact of the second wave vaccinations, the medical infrastructure. Where do you feel are the gaps that Reckitt can help governments around the world, including India, in plugging all these points?
I think it's a very interesting strain of conversation we've just been through. I think that the one thing that's clear is vaccinations are hugely important. It's very important as well to really shore up the medical infrastructure. This is going to take time. In the time when that is happening, as we prepare for the third wave, it's crucial to get ready. Now, one of the things that we've realized is in this sort of intermediate phase, there's a lot of information that is very confusing. And it's not just about the vaccine, which is effective, which is not, which antivirals, correct, not correct. It's also in some of the practices. And what I've seen around the world is there's been a sort of a bit of a political spin on some of these activities. What actions you take, don't take. There's been a spin. This is not correct. That is not correct. It plays into freedom, all of those, very difficult questions. One of the things we did, therefore, and this is a real gap in public health, is we realized that we need to put some money behind actually coming up with some of those answers. And we set aside about $25 million in partnership with Yale, with Harvard, with Cambridge University here, the London School of Hygiene and Tropical Medicine. Dr. Guleri has been very involved as well with AIMS, with Tsinghua in China, but also National University of Singapore. And what we've done is we've actually established a bunch of postdoctoral fellowships in every one of these schools, and even more in Africa and others, in order to do research around how do you ensure we get ready around the science of behaviors and we understand what works and doesn't work. So they can actually be, it's not opinion, it's fact. So research that's going on. The second thing we are doing is, I think the point around schools is a very good one. And I think, as you know, for the last many years, we've been recognizing that building these clean habits in children is very important. Today, we stare at the fact that, 20% of people wash their hands after going to the bathroom worldwide. Now, during the pandemic, the sensitivity of this went up. In some countries, over 86% said we've adopted clean behaviors. But it's very important to instill this in children. So if you take India, we are now in 1 million schools in India teaching clean behaviors. So when kids go back to school, there is curriculum, there's practices, there's things that we have that will actually help them behave differently. It's also true that in the US, one of the things you find in these schools is you actually have people falling out. So in the poor parts of the US, where we have a big brand called Lysol, we're working with schools in underprivileged communities, over 200,000 schools, around behaviors and practices. So schools are a very important place. And the third one is back to the point I made earlier about consumer behavior. I think the point Dr. Guleri made is absolutely correct, which is in this period, there are behaviors we simply must have in our toolkit, and we must behave so. In order to do that, our brands play a role. And we are moving a lot of our money, so to speak, in what we spend to reinforce these messages in partnership with a lot of public health organizations and parts of government that do that. So it's about the Reckitt Global Hygiene Institute, where we put money aside. It's about education, particularly in schools, and it's about consumer behavior and using our brands. Those are areas that we have taken on as things that we can do to partner with governments, recognizing fully vaccination and medical infrastructure become very important.